Hello everyone, my name is Jessica Sennett and I am the owner and founder of Mighty Mom, and I am a prenatal and postpartum fitness expert. And I'm so glad you're here today because you're obviously taken this amazing journey towards motherhood, and I want to help you in any way that I can, support you in this journey. And you've obviously decided to put some sort of exercise into your daily routine, which I'm so excited about. But before you kind of think about how to move your body in pregnancy, I want to go over a couple of guidelines that I have for whenever I work with private clients or anyone that takes my programs or anyone that's really wanting to move their body during pregnancy. I have my 3 foundations for prenatal fitness, and they're kind of all related, and they kind of set the stage for any type of movement that you want to do. I'm all about helping every woman move the way they want to in pregnancy, whether it's Pilates or yoga or lifting or strength training. There is a mental aspect to working out, and we want you to do the things that make you feel great even throughout pregnancy. But there's just a few guidelines and things that you kind of have to be aware of so that you can support your body through all the changes that are going to happen during pregnancy. So I'm going to set the stage for you guys right now. So my 3 foundations for prenatal fitness are: Number 1, core breathing. Don't worry, we're going to talk about this in a little bit more detail. Number 2 is your pre-pregnancy exercise ability. And number 3 is how to listen to your body. And that kind of goes into how to modify your exercise. I know there are some other prenatal fitness or other prenatal professional resources out there that say listen to your body, but that can be very, very vague as to what you're actually looking for and listening for. We're gonna go into detail today in this video so that you have a clear picture of what you're actually going to feel within your body as you're working out. And that may clue you into whether or not you have to modify or take things up a notch or really progress if you need to, right? Because there is such a thing as progressing your exercise during pregnancy as well, I promise you. So let's start at the top. Number 1, core breathing. There is no secret that the part of your body that's going to shift and change the most is your core. And there are many muscles that are involved in your core. It's really all the muscles kind of around your ribs and your hips, around this 360 abdominal wall. But when I talk about core, I really want to mean your inner core unit. There are 4 specific muscles that kind of are responsible for the structure and support of your entire body. And those are your diaphragm. Your diaphragm is your primary breathing muscle. It sits underneath your ribs and it contracts down as you breathe to kind of make room for the lungs to expand so oxygen diffuse across the membranes, right? So your diaphragm is connected to your transversus abdominis. You actually have 4 abdominal muscles. You have your deep abs, your transversus abdominis. I'm going to refer to those as your TA because I'm going to say it so much, it's just easier. You have your inner and outer obliques, which are on the sides of your body. They lay on top of each other and they're responsible for your trunk rotation. And then you have your rectus abdominis. Your rectus abdominis is your top abdominal layer. That's the 6-pack muscle. That's the one you can touch with your hands. I'm going to talk about the RA a little bit later. RA means rectus abdominis a little bit later when we talk about diastasis in pregnancy. So hold that thought about your rectus abdominis. But for our breathing and for our structure and support, we really want to access the TA. And that actually kind of connects in at your sternum, runs all the way down the insides of your ribs, around your abdominal wall, and commingles with your lats at the back and attaches at the top of your pelvis, right here, your iliac crest. So it really does span your entire abdominal wall. It's horizontal muscle fibers. It's really, really important. Your TA connects to your pelvic floor. Your pelvic floor is your diamond-shaped sling of muscles. Starts from your pubic bone in the front, your tailbone in the back, and your sit bones on either side. And let me show you more specifically what I'm talking about. So if this is your pelvis, this is my pelvis here. You can see your pubic bone in the front, your tailbone right in the back, and then there you have your 2 sit bones on the side. And there's actually 3 different layers of your pelvic floor. They have 5 specific functions, really important functions. So we always want to kind of remember your pelvic floor when we're talking about your inner core unit. So specifically support. your pelvic floor is, if you are pregnant, which I'm assuming that you are at this point, is holding up the entire weight of your baby, not to mention all your internal organs. So, this is your uterus, which doesn't have a baby in it right now, but yours does. I'm gonna put this down. And then your bladder, and then your rectum in the back. And then I want you to see inside, there's a muscle layer right at that top. So this sling of muscles is holding a lot of weight, and as your baby grows and gets heavier, it's taking all that weight. So it's kind of working overtime during pregnancy, which is why we're so concerned. Another function of the pelvic floor is sphincteric. You use it to poo and pee, very important. Sexual function, also really important. Acts as a sump pump, so for your circulation and for your nervous system, kind of gets things back up towards your heart and lungs to where that needs to go. And then last but certainly not least is a stability. It's part of your inner core unit. It connects to your TA, and it also connects to your deep back muscle, which goes along the inside of your spine, which is your multifidus. For our purposes, I'm gonna put this down. For our purposes, for you right now, we just need to know that these muscles work together, okay? They're connected. When one is off, they're all off, right? So if you're getting lower back pain or pelvic pain, it may not necessarily be just in your pelvic floor or just in your back or just in your abs, right? And when they work together, they create this pressurized system, and there's a fancy name for it. It's called IAP, which stands for intra-abdominal pressure. It's a pressurized system. So I like to describe it as, like a bag of chips. It's not a great example, but it gets the point across. So, when there's lots of air and chips in the bag, you haven't opened it yet, it has some sort of structure to it. There's a volume there, but when you open the bag and eat a chip and the air comes out, it's got no structure at all. So this is how your system works, on pressure. And there's many different ways to change, increase or decrease the pressure as needed. So let's say you're lifting something heavy off the ground, like one of these heavy plates behind me, you're lifting that up. That puts a lot of pressure on the system, right? Same thing with lifting something over your head, right? Lifting something heavy if you're doing like a shoulder press or an overhead press, right? You can also change the pressure on your system by doing, changing your position in space. So if I'm doing, a plank position like this, where I'm on, kind of leaning forward, or even a plank position on the ground, that's a lot of gravity acting on my body. So it's increasing the pressure in the system. And we need to learn how to manage the pressure through engaging our muscles. When you engage the muscles of the core, you create tension in the abdominal wall, and you can create tension in the muscles, tension in the tissues, which will actually help manage this pressure and kind of balance the pressure from the inside of the system versus the outside of the system, right? I'm hoping that all makes sense. There will not be a test on this. You can watch this video as much as possible. And to be honest, it's not something you're gonna think about every day. It's just really important to know why the breathing during pregnancy and postpartum is so important. It's to manage the pressure. So signs and symptoms that you're not managing pressure well within the core system might be lower back pain, might be pressure on the pelvic floor leaking, urgency, knee pain, and a diastasis. I would like to put a pin in that diastasis right now, because we're going to talk about that a little bit more when we talk about what to listen for and how to modify, okay? But those are some of the things that you're looking for. And the best way to manage the pressure within the system is to activate these muscles. And the best way to activate these muscles is to learn how to breathe. So we're gonna do a little bit of that right now. I want you guys to get comfortable. If you've never done this before, I want you guys to lie down on your back, because it's a good way to kind of start doing this. I'm gonna move this out of the way. So you're gonna start with just kind of bend your knees, put your feet on the floor, and put your hands on your baby, okay? And I just want you to start to take a couple of deep breaths here. I want you guys to stay lying down. I'm gonna roll to the side and stand up so I can talk to you. I can talk you through this, but stay lying down. You can also do this in other positions too, if you're just kind of feeding or doing whatever you need to do, or you're just watching this video for information. But I want you to close your eyes and put your hands on your baby and start taking a couple of deep breaths. And I'm just gonna start to layer in some breathing cues that might be helpful for you to kind of engage and relax those muscles. So let's do it. So as you inhale, everything's gonna relax. Your diaphragm's gonna move down, your TA, remember it's on your entire abdominal wall is going to expand in all directions, right? So on top of your belly button, at your belly button, underneath, lateral costal breathing. So your ribs are expanding in all directions. And at the same time, you're gonna release your pelvic floor. There's many different cues that I like to use. So think about like a flower opening up down there, or if you're holding a blueberry up in your vagina, just let that blueberry go. Just kind of open all the holes and just relax the pelvic floor. And then on the exhale, everything's going to do the opposite. You're just going to do a slight pelvic floor lift, so lifting the pelvic floor up and into the body. This is like a Kegel, but a Kegel is more, we feel like it's like very intense and in the front. Remember, your pelvic floor is around your butthole too. So I want you to think, can I engage my entire pelvic floor, lifting, sucking a milkshake through a straw through my vagina, or picking up that blueberry and pulling it in towards my body. If you're working with a pelvic physio, which I highly recommend, they might have specific cues that you want to work on, and that's a great place to do that. And as you exhale, again, your TA is going to kind of come in and contract like a corset, tightening around your entire abdominal wall. And the cue that I like to use for anyone who's doing any sort of prenatal workout with me is hug baby up and in towards ribs. So if you're 20 weeks, 25, 30 weeks, whatever you are, 10 weeks, 5 weeks, I want you to think about hugging baby up and in towards ribs. This is not sucking in. This is not getting your abs as flat as possible. This is about making those muscles go on an excursion all the way out, all the way in, all the way in, all the way out. Exhale, relax. Exhale, engage. It's really important to have both of these phases. We want to be able to engage the muscles so we can create support, right? And manage the pressure, but it's also really important to be able to relax. Remember, this baby is going to be growing, your body is going to be expanding. So if we're unable to relax the muscles of the pelvic floor and of the transversus abdominis, it really creates a problem because this area is going to expand. I'm sorry, you guys, the boat for flat abdominals has sailed. We'll worry about that later. We want to make sure we have both for proper function, and it's really important to be able to relax these muscles as well. Anyone I work with, I say 3 to 5 minutes a day, practice this breathing. It doesn't come naturally, and that's okay. You might be switching your brain up really hard to do this, and that's totally normal. I want you guys to practice so that when it comes to your workouts and you need to engage, it's there for you. It shows up for you without you really having to think all that hard about it, okay? So that's the core breathing. Number 2, your pregnancy exercise ability directly reflects what you can do during pregnancy. So someone like me who's really active, who lifted a lot before pregnancy, I'm a lifter. I, deadlifted almost 200 pounds. I can squat 150, that kind of thing. What I'm doing in pregnancy is going to be extremely different from someone who's a beginner or really hasn't done a lot of exercise, which is okay before pregnancy. So you really have to kind of know what is best for your body. And just because I was deadlifting 100 pounds all the way up until I was, 9 months pregnant, doesn't mean that everyone is going to do that. If you are a beginner, I don't want you to be scared that you can't do anything during pregnancy. A lot of people think, well, I haven't done anything, so I can't start. And that's certainly not the case. You just want to start in an appropriate place. Maybe start with body weight, start with a beginner workout, and you actually can increase capacity and strength during your workouts, okay? And throughout these, and I think that's a really important point. If you're active and you want to continue lifting heavy and challenging yourself, as long as you're protecting your core unit as you breathe, the sky's the limit. Keep doing what you want to do. You just don't want to put a lot of pressure. You just don't want to do those heavy lifts and those high intensity workouts without supporting the body properly as your baby grows. Number 3, listening to your body. I already touched on it a little before, but how do you know when to modify? How do you know what to listen for? Not listen for, but like how to feel what's happening in your body. So let's go over that list again. If you're getting, back pain, pressure on the pelvic floor, urgency, leaking, any leaking at all when you don't want to be leaking is not normal. Knee pain, and that number 1 thing, let's talk about diastasis in pregnancy. Diastasis is just the thinning of the tissue called the linea alba between the ridges of your rectus abdominis. When there's a lot of pressure in the system and there's a lot of load acting on the body, let's say you're leaning back in like a V-sit position, you might notice this like triangle belly or some coning. That's just a visual representation of pressure. trying to escape the system in the easiest path possible, okay? It's not something to be scared about. 100% of pregnant women get it by 3rd trimester. It's not something I want you to freak out about, but it's something, it's information for you. Okay, so there's a lot of pressure going on. Can I double down on my breathing and create enough tension to support that and maybe make that better? Or if I can't, maybe it's time to modify. So let's talk about push-ups. You're doing push-ups on the ground, right? You're doing these in 1st trimester, inhale down, exhale up, right? And all of a sudden you notice that you can't physically pull your belly in anymore, or you're seeing that coning, you get some lower back pain. It might be time to modify that exercise to maybe an elevated position like a bench or a counter. So there's less pressure from gravity acting on my abdominals and I'm able to engage. So this is the guideline. So if you're having kind of signs and symptoms of pressure management or core dysfunction, it might be time for you to modify. I don't subscribe to the theory that everyone has to kind of do elevated push-ups at 20 weeks or 21 weeks or anything like that. It's not trimester specific. When you feel these certain things happen in your body, then it's time for you to modify. And that can happen anytime during pregnancy. What I want to do is teach you how to listen to what's going on so that when you do your workouts, you can say, okay, this isn't right for me. I know specifically in my pregnancy when I was doing kettlebell swings at a certain weight, at a certain time, I felt a lot of outward pressure on my belly that I wasn't able to support as I was swinging. And it was an immediate signal to me that I needed to go down in weight. Same with an overhead press. If you're getting a lot of pressure out the belly in front and you can't support something overhead, it's time to deload and take that weight down. That will naturally happen in pregnancy. You will naturally deload. It's just trying to listen to when that's going to be appropriate for you. Before I head out, I just want to talk about a couple of breathing strategies that you might think about while you're doing your exercise. From a fitness standpoint, exhale and exertion is a really, really is a really common way to breathe and to support. So if we use the example of a squat, you're going inhale down, exhale as you come up, hug baby up into the ribs, right? Now, if you need a little bit more support while you're doing movements that require more pressure, you might want to exhale through the entire exercise. So inhale, exhale, and all the way up. This breathing strategy might be better for you if you are a little later on in your pregnancy. You just have a lot more weight on your pelvic floor, so you need the support of that exhale, that lift throughout the entire movement, or when you're early on in postpartum as well. Honestly, as long as you're breathing and hugging baby up and in towards ribs, breathing where you want to, where your body naturally wants to, is kind of what we want. Your body is kind of doing this already. It's reflexive. Your core muscles are working. We just need to help it along when there's a lot of pressure. And then last thing I'll say is sometimes you don't even need to think about breathing at all. Like now, I'm standing, my body's working, and I'm not necessarily thinking about it, and that's okay. You don't have to, do a million Kegels all the time. There's such thing as having too much tension, and that will cause problems as well. So light pressure exercises or normal pressure, daily walks, when we do warm-ups and cool downs. I like to do knee raises in my warm-up. Do I have to think about exhaling and squeezing the pelvic floor on every single rep? No, we just want to support when we're doing things, exercises, and this goes for your everyday life too, like lifting heavy groceries up into the car, if you have a second kid, lifting them up into the car, that kind of thing. We want to make sure that we're supporting when we need, but letting your body do its thing when it doesn't. Okay, I think that was everything. Feel free to watch this video over and over again. These things, I'm telling you, again, it's really important to know why the breathing is so important. A couple of tips before I head out. Just make sure you're practicing. Don't freak out if you don't get it perfect right away. Even I don't get it perfect right away. Just make sure you're not holding your breath. Holding your breath puts a downward pressure on your pelvic floor, and there's nothing that you need to do in your everyday life that needs that amount of pressure. Okay, I hope you guys found this really helpful. I hope you guys can head into your workouts feeling a little bit more confident that you can breathe throughout them, you can listen to your body, you can know what's right and when you can modify. And I hope that you can go into your workouts feeling strong and capable. As always, I am here with any questions if you have them. But I want you guys to go work out. Thank you so much for watching my 3 foundations of prenatal fitness, and I'll see you guys all soon. Bye.